Oneself is the enemy. I've discovered the enemy, and it is myself. And autoimmune inflammatory disease. Auto means self. Immune means your immune system. The theory is that your immune system is killing you. And so we have a number of diseases that fit into this category. But is your immune system really killing you? And then, of course, is your immune system something really bad? Well, what if you had no immune system? That's what happened to Bubble Boy. You ever heard of David Vedder? He was born without an immune system. And Baylor College of Medicine knew he was going to be born without an immune system, so they delivered him in the operating room in a totally sterile environment, and they put him in this tent, this bubble, if you please. You see, if your immune system doesn't work, even antibiotics aren't going to save you from an infection. He had an older brother who was born and within a few days died of overwhelming infections because he had no immune system. So you need your immune system, you really do, and well, David Vedder, he spent his life in there. Even NASA got involved and put him into a fancy suit so he could run around outside. When he was about 14, they decided to try a stem cell or bone marrow transplant. It didn't work, and he ended up passing away. All to illustrate, you need an immune system. And what is your immune system made up of? Well, I'd break it down into 3 different levels. The most basic and primitive level, perhaps, is your skin. It's sort of like a plastic bag. Well, no, it's much more technical than a plastic bag, but it's a barrier. It keeps things out. And it's got special oils and so forth that will be on it so that it will not let invaders in. But the skin is there to protect. What happens if you get a rose thorn through your skin? It festers up. And that we call inflammation. And so the next level of your immune system that functions when you have an invader that your body has no idea what it is inflammation, the inflammatory response. A new antigen, a new bacteria, a new virus, any kind of new injury, the most basic response then is inflammation. This is sort of like carpet bombing. You remember World War II and somehow we had something against the Germans, and so we'd go flying over Berlin with our flying dump trucks, and we'd see something down there that needed to be hit, and we'd push the button and the hopper would open and a whole load of bombs would go down there. Yeah, one of them might have hit the target, and the rest of them hit everything else. Collateral damage. Bystander, injury, all kinds of problems with everything else but what we're trying to hit. That's what inflammation is like. Shotgun effect. And you get a bunch of damage. The highest level of the immune system is cellular immunity. This is where one white cell goes and engulfs one bacteria, takes him out of commission, no bystander damage, no collateral damage. This is like where a white cell sends out an antibody, and the antibody marks a bacteria for removal from the system, and it gets removed. Very little collateral damage. This is where you really want your immune system to be functioning at. And so let's just review here. The lowest level of your immune system is your skin, a barrier for sure, pretty technical barrier. And then the next level, if you get your skin breached, is inflammation. Inflammation then is the body's default response to something it doesn't know what is and has no way of dealing with. The highest level immune system is like cellular immunity. So this would be like Desert Storm, precision bombing, where they would take a laser like my little pointer here and send a bomb down the laser into a smokestack or something. Very precision, a lot less collateral damage. Well, so you start doing things that mess with your immune system, as we'll talk about tonight. You start doing stuff that makes it so cellular immunity isn't functioning very well. And then your body starts treating everything with inflammation. All insults, all intruders, everybody gets the shotgun. And then your doctor says, oh, you got too much inflammation, you get rheumatoid arthritis, you're getting SLE, you're getting all these different problems. We got to give you a pill. We're going to give you prednisone, methotrexate, whatever. They just wiped out your immune system. So now all you have left is your skin. And then they argue whether or not they should give you a vaccine unless you die of what's in the vaccine. And so what we have to do is get your immune system functioning way back up here at cellular immunity, not treating everything with inflammation. So if you wipe out your immune system, it starts going down. The other thing you can do is you can make this part of your immune system too strong. It's sort of like a bullfight. You know how it is. The bull comes out and he's had plenty of sleep. He's not in a bad mood, and somebody puts out the red flag in front of him, and he doesn't do anything. So they start getting things and poking him and whacking him until he's all angry, and then he'll chase the red flag. Well, people do that by messing with their immune system by creating inflammation in their bodies, increasing this part of their immune system to where the inflammation is ready to jump on anything like the bull. And so we'll talk about things that create too much inflammation as we go along here. Well, and what kind of diseases crop up when this inflammation goes up? Oh, the list goes on, but polyarteritis nodosa, inflammatory bowel disease, systemic lupus erythematosus, ulcerative colitis, multiple sclerosis, fibromyalgia, asthma, ankylosing spondylitis, polymyalgia. I mean, the list goes on and on and on and on and on and on and on. You go, wait, how can you put all those on one slide? And are they really that similar? When I was in medical school, a lot of times we'd go on a rotation with a specialty, and the people in that specialty would kind of poke fun at the other specialties. So one time we were going around the wards with internal medicine, and some patient had a autoimmune disease, and the attending got to talking about, rheumatology. You know, every patient comes in, they run 100 tests, and for every different disease, 93 of them come out positive. It's just a different 93 for the different diseases. We're thinking, well, that's an awful lot of overlap. And when we got to rheumatology, sure enough, all of them had a positive this or SED rate or something. And then, how'd they treat him? They treated him pretty much all the same. All of them got their immune system knocked out, either prednisone, methotrexate, or some other fancy drug, an antimalarial or something. And so they treated them all as if they were pretty similar. So yes, we kind of lump them all together, and there's a lot of principles that cross over. And so there's a few differences, but a lot of overlap. So let's talk about what perturbs the immune system. What messes with the immune system so that it isn't functioning at the highest level? What makes it react with more inflammation all the time? What makes it worse? Well, does that lady look happy? Stress. Stress is number one. That's right. And where they study this is like people getting job burnout. Oh, I hate my job, you know. And those folks are much more likely to end up with an injury and end up with an autoimmune inflammatory disease. And one of those autoimmune inflammatory diseases is cardiovascular disease. Did you know that atherosclerosis is really an inflammatory disorder? And they can monitor it based on the inflammation in your body. If you've had a major stressful event within the last 2 years, then your risk of getting one of these diseases goes up by 140%. I've had a lot of patients come in and tell me about their disease, and we go back looking to when it started, and oh yeah, it started when grandma died, or it started, they have a stressful event in their life. And what are stressful events? Well, these are like new job, get married, get divorced, have a kid, move to a new location, come to one of Dr. Clark's lectures. No, not really. You get the idea. All right, and this happens so that people who are in more stressful jobs get more of these diseases. Also, people who are only using their brains and not getting a lot of physical exercise are more likely to come down with one of these diseases. People who work outside have less trouble with these diseases. One of the reasons is people who are always thinking the blood pools to their head. When the blood slows down, it starts inflaming. Anything that slows the blood down will increase the inflammation in the blood. In Japan, they have a whole disease they call blood stasis inflammatory syndrome. Because when people quit moving, the blood slows down. When the blood slows down, the toxins it's carrying from the tissues back to the lungs and heart and so forth are in the blood longer, and it inflames the blood. And so this is a problem. So anything that slows the blood, I mean, sitting around doing nothing, sedentary lifestyle, sitting there watching TV, tight clothing, too tight of bands. For example, around the waist. If you have a too tight a band around your waist, it changes the blood flow in your abdominal wall. When it changes the blood flow in your abdominal wall, it's sort of reflected in a change in blood flow down in your intestines. People who have a tight band around the waist, it takes longer for food to get through their colon. It slows their transit time. Well, what happens if food is in your colon much longer? Well, there's some little guys down there that enjoy that. They're called bacteria, and they overgrow. When they overgrow, they start putting off toxins. Have you heard of toxic shock syndrome? Well, this is sort of a constant subclinical toxic shock syndrome. I had a gentleman came up to me after a lecture I was doing on arthritis, and he says, "Oh, you know, my wife, she has this inflammatory arthritis, and it bothers her fingers, they swell, it bothers her knees, they hurt, and when it gets worse, she goes and she does a colon cleanse, and then it's all good for about 3 months, and it starts coming back, and then she has to do another colon cleanse." He says, "Do you think she's hurting herself by all these colon cleanses?" And I said, "Well, there's nothing wrong with a colon cleanse, but I'm just wondering what she's doing to re-pollute the colon every 3 months." But it's all to illustrate, a lot of times what we're getting is a reaction to stuff that's sitting in our gut too long. People who eat refined foods and a lot of animal products, their food takes 3 times as long to go through their intestines. And so the bacteria are overgrowing. And this is a big cause of arthritis. Also, if you let your extremities get too cold, it chills the blood back from your arms and legs, and it all pools in your chest and abdomen and pelvis, and the blood slows down and the inflammation goes up. And on the sedentary lifestyle, they did a study on a bunch of young men. They made them get in bed in a hospital and lay there for 2 weeks. And they watched their inflammation, SED rate, C-reactive protein, interleukins and so forth, tumor necrosis factor, and everything started going up. I mean, if they didn't get out of that bed soon, they would come down with something. So sitting around doing nothing raises the inflammation in your body. I probably should have put this up here in bright red because it's so important. Because your body runs on a clock. Everything runs on a clock. Soybeans run on a clock. They did a study on soybeans where they went out to a patch of soybeans and they shined a really bright light on the soybeans at 3 a.m. in the morning. Then, the next morning, they came and looked at the soybeans without the bright light. Soybeans turned their leaves up to the sun. Every morning at 3 a.m. for the next week, those soybeans turned their leaves up at 3 a.m. even though there was no light, because they have a clock. We have a clock. And that clock regulates a number of things. Serotonin, melatonin, and cortisol in the middle of the night. And if you mess up that clock, you end up with an autoimmune disease. Rheumatoid arthritis patients classically have a messed up clock with too little cortisol and too much melatonin. And so the circadian rhythm is very important. The anti-inflammatory clock malfunctions when meal times are varied. In other words, today I eat breakfast at 8, tomorrow at 8:30, next day 7:30. If I mix up my times of eating, it messes up that clock. Or if I eat too late in the evening, because then I'll go to bed, I'll still be digesting food, and it wipes out my hormones in the middle of the night. When sleeping times are varied, and some jobs, like nursing, where you have a shift where you have to do one shift 3 nights a week, and a different program 4 nights a week, or you're trying to keep up with everybody else, it really messes up the clock. Shift work. Snack attack! Fried potatoes, salty snacks. Are there any antioxidants in French fries? No. And if you don't have any antioxidants, you're not helping the problem. So if you're not a part of the solution, you are part of the problem, right? And so that's a big problem. All these Junk foods we eat, salty snacks, desserts, processed meats, they instigate oxidative stress, inflammation. They raise the inflammation in the body. Can you think of a healthy snack?
Apple, fruit. No snacks are healthy.
Ah, somebody caught on. I just got through telling you have to keep your meal times just exact. And it's better, and we talked about 2 meals a day, didn't we? And so, no, there's no healthy snacks. It implies you're eating between meals. Okay, trick question. Sorry about that. Okay, let's go on. Now, if you fry anything, you take, even the best extra virgin, cold-pressed olive oil with all its phytochemicals and antioxidants, and you fry with it. It'll make trans fat. It'll make oxidized lipids. It'll make acrylamide. There are toxic levels of acrylamide in potato chips. Between 200 and 500 times toxic levels according to some government standards. And so anytime you fry with oil, you are making a very dangerous product that'll increase inflammation in your body and lead to more and more autoimmune disease. Ulcerative colitis. If you eat more oil in your diet, even vegetable oil, even omega-6, it will increase the risk of ulcerative colitis by 30%. Oils are not real great. Well, but I like my oil, and they sell it down at the supermarket. Where'd they get it? From the factory. How'd the factory get it? Well, how many ears of corn does it take to make 1 teaspoon of oil? 12 to 14. And you can't squeeze the ear of corn and get any oil out of it, so how'd they get it out of there? Well, they do what they call chipping the corn, and then they soak it in hexane, it's sort of like gasoline, and they dissolve the oil out of it, and then they heat this mixture up so the hexane will evaporate off, and then you have this oil. It's already been heated for you then. And this stuff was hidden away because, the best way to get your oils, as we found out in our cholesterol lecture, is in natural ways, like in the nuts and the avocados and olives and things like that, rather than using these concentrated products that came from 13 ears of corn. Ice cream parlor woes. Oxidized cholesterol promotes tissue inflammation. This inflammation causes cells to die. When the cells die in your coronary arteries, that's where you start building plaque, inflammatory heart disease. And this will increase inflammation in your body, creating autoimmune inflammatory disease. And so anytime you oxidize cholesterol, it's a problem. How does this work? Well, oxygen is usually the thing that oxidizes cholesterol. So there's my oxygen molecule. And since cholesterol is usually the one that gets damaged, I'll use it as the illustration. So the oxygen comes along, and it comes over the cholesterol, and it takes a bite out of it, essentially. Oxygen is hungry for electrons. It steals them from cholesterol. And then your cholesterol is oxidized. It becomes a free radical, and the inflammation goes up. So what the cholesterol does is it goes through the bloodstream. The cells take it up. But when the cells take it up, it takes a bite out of the cell. And the cell dies, and the cell starts leaking its contents all over your body. Oh, could I have 12,000 units of antioxidants with that fried chicken and large fries? It would be good. And what do antioxidants do? Well, they're sort of like pillows, would you say? Well, they're sort of like when they have a race, they put up hay bales in case somebody gets off the track, they hit a hay bale instead of the wall. The oxidized cholesterol hits an antioxidant, and the antioxidant either is a free radical scavenger and takes it out of the system, or the antioxidant gets oxidized, but it doesn't cause damage. And so it has stopped the cholesterol in its tracks. And people who get autoimmune diseases classically eat too few antioxidants. They're not eating enough fresh fruits and vegetables. And so like we said, these oxidized cholesterol molecules kill cells. The cells dump their contents into your bloodstream. The bloodstream looks at them and says, what was that? I just saw a DNA molecule go by, but there's not supposed to be DNA here. Send out the antibodies or something. And so when you go to your doctor and you have rheumatoid arthritis, what do? They check to see how how many antibodies you have to junk that fell out of cells. Anti-nuclear antigen, anti-double-stranded DNA, anti-single-stranded DNA. These are antibodies to junk that fell out of cells because you raised too much oxidative stress in your body and the cells split open and spilled their contents everywhere. And so oxidative stress is a huge precursor to getting an autoimmune disease. What are other things that raise your inflammation? Mince pies, cakes, preserves, highly seasoned things like meats and gravies, pickles, salt, grease, pepper, mustard, ketchup. Let's just look at some of these in more detail. How about salt? What happens if you eat too much salt to your blood pressure? It goes up. And I used to think that the reason your blood pressure went up when you ate salt is because you retained a lot more fluid. But I found out something very interesting. Salt causes inflammation in the wall of your blood vessel so that the blood vessel wall is inflamed and it starts to scar down. As it scars down, it makes the blood vessel into a hard, leathery pipe that doesn't pulsate with every beat of the heart. It just sits there real hard. And this not only raises blood pressure, but it increases the risk of other things. Well, wait a minute. Aren't there autoimmune diseases that are nothing but vasculitises, problems with the blood vessels, too much inflammation in blood vessels? Temporal arteritis, systemic lupus erythematosus, a bunch of kidney problems. And so this inflammation that's created by this causes kidney disease and blood vessel disease. Too much salt. How much? Okay, it's quiz time. Which has more salt, potato chips or Cheerios? Cheerios by about 3 times. Which has more salt, corn chips or tomato sauce? Tomato sauce by about 3 times. It's very hidden. Any processed food is high in sodium. And you look at it and you'll find that the majority of the salt you're getting is hidden. You have to read the label and see where it's coming from.